Well, good morning, everybody, and welcome to, we're filming this on Monday, October 21st in the morning. It's an absolutely beautiful Indian summer day again. We're blessed with it. So I don't know when you'll be seeing this, but we're very, very fortunate to have a great guest and a great topic today. I'll just introduce the folks at the front of the room. We have Nancy Jassain, who's representing the Friends of the Council on Aging. You all know about the Friends and how much they do to provide support for all the programs that Angela produces. Angela Smith needs no introduction, but I will introduce her anyway as the outreach coordinator and the person that gets everything done. And David Klein is the person with the whip who whips Angela Smith so that she gets everything done, the executive director of the Council on Aging. And this morning we have Alexandria Papadimoulis, who is the outreach. She's the Angela Smith of her organization, which is the Rhode Island and Massachusetts Regional Center for Poison Control, and runs a hotline. And we'll hear a lot more about the hotline from Alexandria in a few moments. So, Angela, would you like to?
Well, I think we're going to let David take us off.
David.
We try to keep you on your toes here, Carrie. Hello, everyone. I just wanted to take a moment to thank the Concord Carlisle Community Chess. I was a panelist on their Women in Philanthropy luncheon last Wednesday, which was at the Concord Country Club, and that was a great experience. We were talking about, along with other panelists, needs in the communities, and they did a great job. They really support a lot of different organizations. So, along with our wonderful friends of the Carlisle Council on Aging, the Community Chess is just a great partner in the community. Secondly, our newsletter, which just, the hard copies just came into our office this morning, so they'll be mailed out on
Wednesday.
Wow, okay, so we're going to get them out early.
Yes.
Early this year.
Exciting.
And it's the upcoming issue is the November-December issue that we have here, and it's got information in there, chock full of information about our friends of the Carlisle Council on Aging and their annual fund drive coming up, which I'm sure Nancy will speak to. But also on the front page is a piece that I wrote about our community center survey. It's an update. Our Chennault grant, which is funding a feasibility study for the community center, is about to expire or about to run out on November 30th. And so we're winding down several different projects. One is the community center feasibility study. The other, as some people know, is a program that we have with Lyft, where we're subsidizing Lyft rides. Although I want to let people know that we're actually going to be continuing the subsidy for the Lyft rides beyond the Chennault grant. We do have enough funding to do that, at least through the end of the fiscal year, and after that we'll figure things out. But the update on the feasibility study is that we did a survey through SurveyMonkey, so it was an online survey. It was 5 questions. The average time to take the survey was about 2 minutes and 15 seconds. So it wasn't too hard on people.
I've taken it, David, but it took me 3 or 4 minutes. I'm a slow reader.
Yeah. I hear you. I could, if you really care about it, you're gonna be painstakingly, like one of the questions was what time of the, if we had a community center, what time of the day would I go, or what time of the weekend would I go? So I'm sure, Carrie, you put a lot of thought into that. But that's great. I mean, the first question on this survey was, what would inspire you or your family members to participate in activities or events? And then we had a listing of about 10 different things, and people could check off as many as they thought that they would utilize. One of which was visiting the Council on Aging to take advantage of our social services. That, along with doing homework, seemed to come at the bottom of the ranking. But the one of the updates is that we were aiming for 300 responses. As a matter of fact, the newsletter says that we're just under 300 responses, but now we have about 375 responses because we had some type of late influx of kids who took the survey. So somebody did something that got the school-age kids participating, which was really great. So one of the things that is gratifying about the survey is that we have participation from really all the different age groups. It's not just seniors who took it. It is the age group right below us, the 34 to 35-year-olds or 35 to 44-year-olds, I think was the biggest block. And so great participation. It's no longer on the front of the Carlisle website. It is still, you could still access the survey hypothetically through the Carlisle website by going to the website, which is carlislema.gov, and then going to the COA portion of the website. It is still out there. We didn't take it off. But I think for all intents and purposes, we're happy with the results that we have. If we inch up towards 400, great. But if we don't get any more, then we think we've had a strong representation of what people in the town think. And at some point, whether it's through the mosquito or some other way of getting the word out, we'll let people know how the answers to the questions came out.
Great.
So anyway, thank you for the opportunity to mention that.
So I think we're going to go to Nancy because poor Nancy's struggling with a cold. So we're going to let her tell us about the Friends and then go take care of herself.
Nancy, the Friends have been in business now for over 20 years, I believe, haven't they?
25 years, yes. Yes, I'm going to talk a little bit about that in a minute. I just wanted to say that recently something came up that sort of pointed out the uniqueness of Carlisle. Two members of our board, excuse me, went to a meeting at the Acton Community Center, and this was a meeting of friends groups from this area. And they discussed fundraising techniques and different kinds of relationships between the seniors and the community. And during the course of the discussion, what became evident is that there's friction in other towns between the seniors and other constituencies. And so Jean Bagnaski and Vanessa Maroney decided that they wanted to share ways in which in our town we cooperate with one another. And so, of course, the first thing they pointed out, something well known to you, Carrie, is the multi-generational award that we won in 2015. But also, even more recently, as we do sort of conceptualize this idea of a community center, it is by taking the input from all the broader community that we would be able to create a community center that met the needs of the entire community. So that they thought was very important. Also, they were struck by the success of our fundraiser every year. And that, of course, means that we are getting funds from the broader community, not just from our seniors, which is quite important. And we also, as a board, we give some funds to the local library for things like large print publications and digital books and audiobooks. And certainly seniors are interested in those, but the whole community can profit from those. And recently, we have given funding for children's books. And these are sort of targeted as books that children can share with their grandparents. So we thought that was great. So this is just, again, pointing out the uniqueness of our community. So onto the schedule. So coming up for the Fall Cultural Series, we'll be continuing. Professor Jason Giannetti will be talking about myth and religion. He'll be examining how myth and ritual and religion and the sort of the sacred, what constitutes the sacred, how these things relate to one another. These will be held at the library, as usual, at 1:30 on October 30th, Wednesday, and November 6th. So if you're interested, please do call the library or sign up on their calendar. Next, we have podiatry clinics coming up at the beginning of November. Monday and Tuesday, November 4th and 5th, there will be podiatry clinics at the Benfield building. If you're interested in these, call the COA office and book an appointment. I'm mentioning this because this is partially subsidized by the Friends of the Carlisle Council on Aging. but the cost to each individual is $25. And excuse me, also be watching when the town census comes out. There's going to be a little piece that tells you what the Friends of the Carlisle Council on Aging do in case by some chance you've missed it. And then finally, at the end of November, our brochure is going out. And this is our fundraising brochure. And this, I want you to make sure to look for this picture of your friends with our huge birthday cake, because we are celebrating our 25th anniversary of providing money for, or funds for, programs and services through the Council on Aging, of course. And it is only through your contributions and the generosity of this town that we're able to do that. So we thank you for providing these funds. We hope to have you do it again this year. And we especially thank David Klein and Angela Smith and the whole COA staff who are just work so well and wisely with the funds that we provide, as well as other funds. So thank you.
Well, thank you, Nancy, for continuing your leadership and continuing to support the organization. It's been a pleasure to work with you on that. And I know that you and Angela are joined at the hip on this relative to program. So it's been good all the way around.
Matter of fact, we're meeting Martha Feeney-Patton, myself, and Estelle Keys, who are the program committee for the cultural program. We're meeting this Wednesday to start planning next year.
Wow. Lots in
So-
advance, yes.
And I just yesterday picked up gift certificates because we do try to help the seniors who are low income with a little bit towards food, and the fuel assistant time is coming, and there's just so many things. We've been buying more medical equipment because we've run out of a number of things. So there's just so many things that we would not be able to do if it wasn't through the Friends. So we really want to thank you all and thank everybody out there for contributing. And I think it's Jean Bagnashi who always says, if you've been giving the same amount for a long time, maybe you want to consider upping it a little because the cost of things have gone up. So we'll just repeat her reminder and thank everybody very much.
I think Curry actually might have been the person who came up with that, doing a little bit more, or was it Gene?
Oh, I have no idea. I'm always asking for more money.
Yeah, yeah. Whatever, a good idea. We can share the
Yep.
gratitude.
Absolutely.
Well, you know, it really has, I've seen a noticeable increase in activity as a result of funding and discounts given. For example, the Neshoba Technical High School lunches,
That's a good example.
those are subsidized.
Absolutely.
I mean, you can't get a better 10-course meal than going over there. They really do a great job, and it costs like $5 plus a tip or something like that. And we started with half a table, and now we're doing a full table, and now we're up to 2.5 tables full of Carlisle residents going over there once a month for a lunch, wonderful luncheon. So it really makes a difference in getting people up out of their chairs, their easy chairs, and doing something that is fun.
So thank you so much for all that you do, because Carrie is on the Friends
That's
board,
right.
as well as Nancy and Jean. And maybe we can turn over to you and have you and Alexandria tell us about the Poison Control Center.
Well, we're really pleased to have Alexandria Papadimoulis with us this morning. You probably don't know, but there is a poison control hotline that is a service offered to all of Massachusetts and all of Rhode Island.
It's actually national.
Pardon?
It's all over the country.
Oh, okay, but your region is
Yes,
these
my-
two states, and it is a national hotline, that's right. And it's interesting, I keep thinking about when I saw her going to be on the agenda. We had, one of our kids was, I think, about 2.5 years old, when in the excitement of getting ready for a wedding, he got into another room unnoticed and drank a couple of ounces of French perfume. And we didn't know what to do about it. We didn't know that there was a hotline to call, or we didn't know anything about what to do next, except to admonish him that it's not the the smartest thing to be doing. But if you are in a situation, I guess, well, first let me ask you just to describe the regional office that you are representing for the
Sure.
hotline.
So we offer two services. One is educational, so going out to the public, talking to healthcare providers also, and just giving them education, promoting the hotline because certain people may not know about it. And we try to target parents who have children under the age of 5 because they're more likely to get into harmful substances, but also older adults because they are more likely to have serious and fatal reactions because of medication errors. And then we also offer the hotline. You can call 24/7. All calls are confidential. We offer 150 interpreter services, so if you don't speak English or another language like that, we have options for you. And when you do call, you're going to be talking to a SPY, which is a specialist in poison information. And these consist of doctors, toxicologists, nurses, and pharmacists, so you know you're getting reliable information. And you can also call if, say, you've had a poisoning, someone you know has had a poisoning, or for information about medication. So say you missed a dose and you want to know what to do next, you can call and we can provide information.
Well, we use the term poisoning, and yet it covers so many different kinds of situations that you can get into. And I know, I think if there was a situation where someone got into something they shouldn't have gotten into, your first reaction might be, well, let's jump in the car and go to the emergency room, right? I mean, we don't know what else to do. And yet that can get to be a pretty expensive proposition, can it?
Exactly. So the national average bill for the emergency room can range from $1,200 to $2,200. And most of the calls we get, 70% actually of exposure cases, can be treated on the site of exposure. So if you give us a call before heading to the hospital, we can help reduce those costs.
Yeah, that makes a lot of sense.
Yeah.
Yeah. Well, how many calls do you get a year?
So for 2018, for just Massachusetts, we received close to 33,000 calls.
33,000 calls.
Yeah,
Wow.
that includes information and exposures.
Right, right. Okay. Well, I think you have some information you'd like to present.
Yeah.
Can we do that? Segue to that?
Sure.
Yeah.
Perfect. So once again, I'm Alexandria Papadimoulis from the Regional Center for Poison Control and Prevention, and I wanted to thank you again for letting me come and speak with you and provide the service for the city of Carlisle. So what is a poison? A poison is any substance that can cause harm or illness if someone eats or drinks something, touches it or breathes it in. So anything can be a poison when it's used in the wrong way, wrong amount, or by the wrong person. And this, again, can happen through inhaling, through skin or eye contact, or from injection. Paracelsus is a Swiss alchemist and physician, and he once said that poison isn't everything and no thing is without poison. The dosage makes it either a remedy or a poison. So in other words, a substance can be beneficial for you and your health, but if you take it in the wrong amount, or especially at a high amount, it can be fatal.
Well, I have a couple of medications that I take every morning. Two of them look exactly alike. And it would be so easy I have to turn the lights on real
Yeah.
high and put my glasses on to look at these things to make sure I'm taking the right. So they are a remedy, but I could very well be taking them and making them poisonous to me.
Exactly. And if you had a question about which medication was which, because you said it was one looks very similar, you can always give us a call and describe it, and then the spies will be able to help you with that.
Right.
So some national poison data is that poisoning is the #1 injury death in the United States. Every year, nearly 2.5 million poison exposures are reported, and of those 2.5, 75% of the poisonings are unintentional. So children eating something they don't know, or a medication error for an older adult, things like that. So for Massachusetts in 2018, we received close to 33,000 exposure calls, and 18 of those calls or cases were fatal. Half of those fatal cases were for individuals 50 years and older. So to dive more into that, we're going to look at this chart right here. And as you can see, it explains while children are more often exposed to poisonings, adults have more serious poisonings and injuries. So what is a medicine? A medicine is any substance or substances used in treating or preventing a disease or an illness. So this includes prescription medications, over-the-counter medications such as Advil, Tylenol, Robitussin, herbal supplements, sometimes can be peppermint, ginger, St. John's wort, and herbal supplements, dietary supplements, so vitamins. And medications, they're not just in pill form. They can come in the shape of a patch, a powder, a cream, a drop, an injectable liquid, and then liquid you're supposed to swallow. So the most common poisoning for adults, especially over the age of 50, are medications. And we're about to dive in as to why. And as of 2018, 74% of the exposure calls that we received in adults 60 years and older were for medication errors. The top exposures would include cardiovascular drugs, painkillers, sedatives, hypnotics, and antipsychotics, antidepressants, and household cleaners. While older adults comprise of only 13% of the U.S. population, 34% use at least one prescription drug and 30% use a non-prescription drug. And 87% of adults 65 years in age and older take at least one prescription medication. And on average, there was a study done that shows that if an older adult is taking one medication, they're most likely taking 4 or more. So that also, again, includes herbal supplements, dietary supplements, and over-the-counter prescriptions. So we're going to right now talk about some ways that we can reduce the risk of poisoning because it is preventable. One is to participate. It is your health, so you want to make sure that you're engaging with your doctor, your pharmacist. You want to make sure you're talking to and knowing what you can do to help reduce the risk. If you're going to use any source of information online, you want to make sure that it's a .org, .edu, or .gov because those are going to be the most reliable. But most importantly, if you're getting any information, you want it to be from your primary healthcare provider. So this can be a nurse, your doctor, your pharmacist. They're the ones you're going to want to go to because they're going to have your health history and be the most prepared. In addition, you can also call the Poison Control Center, say if it's late at night and you're taking your medication, your doctor's office is closed, you can give us a call. Everything is confidential, it's 24/7, and we'll be very happy to help you. When you do go to the doctors, you can make sure you're asking them these questions when they're prescribing you new medication. What is the name of my medication? Why am I taking this medication? How is it going to be beneficial to my health? What side effects could I experience? How much medication should I take and how often? Should I take this medication before, during, or after a meal? What do I do if I miss a dose? And what should I avoid taking while having this medication? Next, you want to always read and follow the entire medication label. This includes over-the-counter. You want to make sure you know how much medicine to take and how often, and whether there are certain foods, beverages, or other medications you should avoid. You also want to keep an up-to-date list of all your medications. We especially recommend doing this because older adults may sometimes forget what medication because there could be a long list. So it's important to keep it all written down so when you do go to the doctor or the pharmacist and they want to prescribe you something else or change your medication, they know exactly what you're already taking and they'll be able to help you from there.
Well, right now we're in a process where we can take a look at our Medicare coverage, for example, and if we want to change it, we can go online to the government's Medicare site and key in our medications.
Really?
We need to know what they are, the dosages, and then it can direct us to which plans are available and what those plans cost. So it's a good time to write it down anytime, but right now it's particularly helpful to have that information at the ready.
That's awesome. To reduce the chance of another individual getting into your medication, you want to make sure that you keep it up and away and out of sight of children, teenagers, adult visitors, and pets. It's also important to dispose of expired medications and ones that you are no longer using because this can help you prevent a medication getting into the hands of the wrong person. And then the fifth one is to be prepared. Know who to call when you have an emergency. So if you have an emergency such as someone collapses, stops breathing, or has a seizure, you're going to want to call 911. You don't want to call the poison control center. But say if you just have a question about, oh, I may have taken 2 doses, how is this going to affect me? Should I go to the doctors? Things like that. That's when you can call. Or say if someone is out in the yard and they see some berries and they don't know what the berries are, but they're hungry for a snack, so they eat those, you can always give us a call. We can help you further from there.
What happens if my dog eats something he shouldn't eat? Can I?
So if we unfortunately don't take calls for animals, but if you did call the poison control number, we would redirect you to the animal poison control number.
All right.
There is a hotline for them, yeah.
Great.
So some safety tips is to review your medications with your medical professional, so your doctor, nurse, practitioner, or your pharmacist. Don't use more medication that is prescribed to you. And in addition, do not take someone else's medication because what may work for them may not necessarily work for you. So it's important to only take medication that is prescribed to you and what your doctor thinks is best for you. And then in addition, it's also important to try to leave medication in areas where they're going to take showers or baths because the dampness can deteriorate the medication, so you're not getting the full dose you're supposed to. Compare active ingredients. It's very important. If so, say you're taking a medication that has acetaminophen and then you feel sick, so you're taking another dose of say like Robitussin and that has acetaminophen in it, you're taking more than 1 dose than you're supposed to. So it's very important to keep track of what you're doing, what you're intaking. Plan to refill your prescription so you're never missing a dose or you're never behind. Never take medication in the dark, so this way you can know exactly what you're taking and when you're taking it. And properly dispose of expired and unused medication. So there are a couple ways you can do this. One, there are National Take Back Days. They happen twice a year. I think the next one coming up is the 26th of October. And you can contact your pharmacist or local police station. They can provide you with more information on that. You also have drop-off boxes, so for hospitals and pharmacies and the police station. If you want to know where these drop-off boxes are, you can go to, the DA has a website for hospitals and pharmacies, so you just type in your zip code and it will pull you up to the locations closest to you. And then there's also a website on the MassGov website and for police stations, so you, again, just type in your zip code and then they will show you the information of where you can go next. If you are doing an in-home disposal, you want to put your medication in something that people are less likely to eat, so say cat litter and coffee grounds, because that way it's going to prevent people from going into your trash and taking medication or your animals going in and eating their cat litter. And you want to place the mixture in a sealed bag and you can just throw it away in the trash. And then there are certain medications you can flush down the toilet or down the drain, and they will be on the medication label. It will say you can put this down the toilet or it can go down the drain. But there's also a link on the FDA website that has information on which ones can actually go down. And just a couple of those can be fentanyl and acetaminophen. So always take caution when you're adding dietary and herbal supplements to your daily routine. There has been 1,500 documented interactions between drugs and herbal supplements and dietary supplements. Natural does not necessarily mean safe. Just because a product claims that it's natural doesn't mean that there are hidden metals and other harmful substances in there. So just be sure that you're reading and you're really knowing what you're putting into your body. And you can also, again, call the poison control so we can help you provide information of what's actually in there, or you can, again, call your doctor to see how it may affect your medication. And then again, supplements can also change the way medication is processed in the body. So you want to, again, make sure you're talking to your healthcare provider so they know how something is affecting you. So now we're just going to run through a couple scenarios of things that you should be aware of. So this is Joe, my nice buddy right here. He's been taking warfarin, a blood thinner, once a day for the past year. So some family history on Joe is that his dad passed away from a heart attack. And so one day, Joe's watching television, and there's a commercial for baby aspirin, how they can help with heart disease. So because he's seeing this, and because of his family heart disease, he thinks it's a good idea to start taking some baby aspirin with his warfarin. So one of the problems with this is that Joe first didn't consult with his doctor to see if this would be beneficial for his health. And two, because he's already taking warfarin, which is a blood thinner, and then adding aspirin, it can cause problems such as easily bruising, strokes, and abnormal bleeding. So again, it is very important to speak with your healthcare provider before adding anything. Next, we have Ellen. She enjoys bike rides, She drinks a cup of grapefruit juice every morning with breakfast. She's feeling healthy with a lot of energy. And then after her annual checkup, Ellen's doctor says that her cholesterol is too high, so she's going to prescribe her some medication for that. So to stay even healthier, Ellen decides to keep drinking grapefruit juice and then adds another glass at lunch. So one of the potential problems here is that as tasty as grapefruit juice may be, it can manipulate the way it's processed, and her medication is processed through the body. So in the case of cholesterol medication and grapefruit juice, it can add a buildup and cause significant muscle problems. So again, it is very important to consult with your doctor, and then you can also, again, call the poison control if you have any questions. So a helpful tip to reduce the risk of missing a dose of medication can be to have a pill reminder box. So you can have all your medication throughout the day in there so you know if you've taken it or if you missed it. You can keep a journal. You can make a checklist, set an alarm on your phone. And there are actually smartphone apps for people nowadays where you can just go to the App Store and just type in medication if you have a smartphone. And then you can type in the medication you're taking, how many tablets, the description, and it will provide you with an alarm of when you should be taking your medication or when you're down to 5 pills to remind you to schedule an appointment to refill. Next, you want to make sure you keep everything in the original container, because some products may look very similar. So as you can see on the screen for Crest mouthwash and Mountain Dew, the colors are very similar. So say that you want to save some room under your sink for mouthwash. So you think, oh, I'm just gonna take this empty bottle and pour my mouthwash in here. Well, then what if someone comes around and they see that and like, oh, Mountain Dew, awesome, I'm gonna drink some. So then it's just very important to make sure you have everything labeled correctly and keep it in the right container. Next is carbon monoxide poisoning. It is odorless and it is colorless, so you don't really know if you're experiencing it. So you want to make sure you have your furnaces and heating systems inspected annually. You never want to use a grill or hibachi inside. Never operate a gas-burning appliance in a closed space, and install carbon monoxide detectors, especially in areas where you are sleeping, and then replace the batteries, check the batteries to see if they need to be replaced when you turn back the clocks, because this way, or at least when you're turning back the clocks, it's another simple thing you can do to make sure your batteries are up to date. And then just replace your detector batteries every 5 years. And then familiarize yourself with potential poison sites. Preventing a poison is not just about getting everything toxic out of your house, because that's just impossible. It's about being prepared and knowing ways to reduce the risk. So in case if something does end up happening, you know the precautions and the steps to take next. So for child poisonings, around 60,000 young children were brought to the emergency room each year after getting into medicine that was left within reach. Grandparents are 4 times more likely than parents to leave their medication in an easy access place because they could be taking it on a regular basis. So just take the precautions of storing your medication, keeping substances out of reach and hidden from children is very important. And in addition, there was actually a study shown that 80% of parents and caregivers were giving their young kids medication at the wrong dose. So a way to avoid this is
80%?
Yes, 80%.
Oh my gosh.
Yeah, so some people, especially I know when I was younger, my parents would give me liquid medication on a tablespoon, and they'd be like, okay, this is the right amount. But you don't actually know how much you're getting in that tablespoon because they all come in different shapes and sizes. So it's very important to use a syringe that has measuring labels on it and then also a measuring cup. So one of those options. The top exposures for kids in 2018 in Massachusetts was cosmetic and personal products, painkillers, foreign bodies, toys, household cleaners, and vitamins. And since Halloween is coming up, I do want to also reiterate that the glow sticks, they're very helpful, but it's also important to use flashlights because glow sticks, because they are for kids, they do have the liquid that's inside of it. It's very dilute, but it can also be a mild irritant. And when swallowed in large amounts, it would require you to go to the hospital. So just try to, if you are giving a child a glow stick, make sure that they're not trying to chew on it and putting the liquid in their mouth. So keep medicine up and away and out of sight of children's reach. There are also cabinet locks that you can use, but again, there is no substitute for adult supervision. So say I was speaking to one individual and he had a cabinet lock, but his daughter was watching him how he opened and closed this cabinet lock. So it is important to watch, because children will watch you and see what you do. Monkey see, monkey do, and they'll try to get into the cabinet.
We had trouble finding a place that sold those cabinets. We finally went to Bye Bye Baby in Nashville to
Really?
get them, but I don't, do you know where they're carried?
I feel like they do have some at Rite Aid and places
oh,
like
sure,
in
of
pharmacies
course.
and things
Right,
like that. But
right.
yeah,
Yeah, they're very effective.
yeah, they are. Another is to store your medication in a lockbox and put it in a location that's not easily accessible to a child. Some lockboxes even have a code, so you, instead of just having it just a pull-down lock, it has a code that you have to type in. So that way, it's another way to make it harder for a child to get into your medication. And here on the screen, you can see that we have a display of medications and candy, and they look very similar. So if you can't tell the difference between this medication and which one is the candy, how can a grandchild or someone younger distinguish the difference? So it's important to never refer to medication as candy, because if kids think it is candy, they're going to try their hardest to get into it. It's also important to keep your medication in the child-resistant packaging, because it's going to make it harder for a child to get into it. Avoid leaving medication in Ziploc bags, because that's an easy access for a child. Keep all medication and vitamins out of a child's reach and sight, and then teach your grandchild or your niece or nephew to always ask permission if they don't know what they're eating or drinking, because it could be something hazardous. And then just to recap, you want to make sure you secure the child safety cap and packaging after every use. You want to put away any potential hazards as soon as you're done using them. You want to follow and read all of the directions on your medication. This, again, includes prescription over-the-counter medication. And then never mix household products together. And then over here, we have the hotline number. It's 1-800-222-1222. You can call this number again anytime, anywhere. You're going to talk to a professional who has extensive background on the poison information, mushrooms, berries, things like that. We also do have a Facebook and a Twitter page for people who are interested in that, where we post helpful tips for like seasons, and it's another way to get some information about poisonings and to get in contact with us. And then I wanted to thank you again for allowing me to come in today. It was a pleasure speaking with you.
Well, thank you very much. I think you're right. You're speaking to the right audience with this, because as the statistics indicate, most of this stuff happens either because you're a careless grandparent, or you're not paying attention to your own medications as a senior, or combinations of those two. So it's, I know I vaguely remembered not having not drinking grapefruit juice when I was taking a medication for my cholesterol. I vaguely remembered that, but there's so many little combinations of things that it really behooves all of us to take a check on what we're taking, why we're taking it,
Exactly.
and be in touch with our healthcare provider to update that information. So we have so many opportunities to fail here, and it's so important that we don't.
One of the things that we also like to tell people is that if you do end up using our service, it's not a fail. We're just an extra hand to help you in case you make any mistakes or you just have any questions.
I like the notion of calling a spy.
Yeah.
And our police station does have a container in the lobby, so you can just dump all your medicines that expired or you're no longer using into a Ziploc bag and dump them there. People may not want to put them down their toilet because we're on wells.
Okay.
And so I don't know how much of it could end up in your groundwater. So always better to take it to the police station.
Agree.
I thought it was interesting that you included, Alexandria, included the carbon monoxide poisoning in there. You know, we don't think about it that often,
Exactly.
but they're,
And especially because it is odorless and colorless, you don't know if you're actually being exposed to it.
right.
So let's move on from this very helpful information and quickly hit some of our upcoming events. We do have lunches coming because it's holiday season. I can't believe we're actually talking about Thanksgiving and Christmas, but we do have our Council on Aging holiday Thanksgiving lunch on Thursday, November 21, and our holiday winter December on December 19th. They're both at FRS, and you can call the COA at 978-371-2895. And for Thanksgiving, we'll have the traditional turkey dinner. And for our December meal, we're going to have roast beef. And then there's always the lovely meal at the high school that the students put on, and that's another Thanksgiving dinner. And that will be on Saturday, November 23rd. People can call us, and the first 13 people can get rides over with our van. And then we'll be going, as you talked about, to Neshoba Tech in November and December. And we're going to get some very unusual meals for both of them on November 20th and December 18th. And our Chelmsford Crossing lunch is coming up very quickly in the beginning of November, and then we'll be having one on December 4th as well. So, David, do you want to talk about transportation or some trips that are coming?
Sure. Question, did we mention the Thanksgiving lunch already?
Yes.
Oh, okay, all right. That's always a nice event, but it's on a weekend, so it's a little bit different.
Alexandria, as you can tell, we're all well-fed here.
Yeah,
good.
yeah. We don't, one of the things that's going on is we don't have our own senior community center, so we do a lot out in the community, which really has its advantages too in terms of engagement in the community, but it just, other steps that we need to take to get the word out. So transportation-wise, we have our regular van, as people know, that operates during COA work hours, which are generally 9 to 3. Sometimes if people have an earlier morning or later in the afternoon appointment, we try to accommodate them. We also have a relationship with a company called Flow Transportation and a voucher program. People can come in and purchase vouchers for discount rides through this company, Flow. There's some news there in that they actually just turned in a vehicle that we had given them 4 years ago. They've put 120,000 miles on it, and the LRTA is taking it back. And we're about to start an RFP process to search for a new vendor for a new vehicle that we're getting. It's a Dodge Caravan, actually, that we just got. It's wheelchair accessible through a ramp, and it could be Flow, it could be somebody more local. But we valued our relationship with Flow too, so we hope that they still remain an asset for our residents, both those who are ambulatory and those who are non-ambulatory. We still also, as I think I alluded to before, have this program with Lyft where we're offering up to $10 discounts on Lyft rides. So you can go anywhere you want within 55 miles of Carlisle, and you'll still have $10 off. So a trip to the airport, or a trip to go shopping, or a trip to get ice cream, or a trip to go anywhere, actually. And if you are a little bit leery about using Lyft or Uber, I think a good idea would be try it locally. Maybe, go with a friend or go with a spouse, and because really it's no extra charge for more people. It's like a taxi ride. As many people will fit into the vehicle as possible is how many you can take.
And David, for those of us who don't have a smartphone app for Lyft or Uber, how do we?
Well, we're working with two things. One, the COA can book rides on behalf of somebody that we're currently paying for. We haven't been advertising it in a big way, Kerry, because it's a cost to the COA that we don't mind doing. The limitation there is if you have, let's say you have a medical appointment and you have no way of getting there, we can book a Lyft ride for you, and they'll come and pick you up take you to the medical appointment. It's all good. When you're done with your medical appointment, you're supposed to call us. We call Lyft, we go through their computer, they do the ride, and somebody comes 10 minutes later, picks you up and brings you home. But what happens if your medical appointment gets delayed, the doctor's office is too full, and we're not here to take your call to do the return ride? So that's another reason what we're a little bit skittish about telling people that we can definitely handle that. If it's earlier in the day, I think it's fine. If it's a later in the afternoon appointment, we're a little bit unsure about being available to do the return ride for folks. I mean, to the extent that if somebody just needs a one-way ride and they have a resource for the return ride, then that's great too.
When
And
push come to shove, if they were stranded, they could call and get a Lyft or Uber ride anyway and pay for it themselves.
that's
right?
true
I mean,
too.
they-
Yeah,
they-
that's true too. And we're also going to try to be working with the companies. Matter of fact, I have a conference call with them tomorrow called GoGo Grandparent or GoGo Technologies, which allows you to use Lyft or Uber without a smartphone at all. You can call GoGo Technologies. They operate 24/7. An 800 number. They'll book the ride on your behalf. They'll track the ride, and if you're sending somebody else, a loved one or a friend on the ride, they'll actually send you text messages to make sure that they, where they're at. So there's a safety component there, and they charge a little bit extra on top of the Lyft or Uber. So they charge an extra 27 cents per minute. The average Lyft or Uber ride is about 15 minutes. So it's about an extra $4.05 on the average Lyft or Uber ride to use GoGo Grandparent. But it sounds like it's well worth it, and we're hopeful that will work out. So, it's not, I don't know if any solution is perfect, but since there's less taxi companies available these days, this is a method of having on-demand transportation. Because sometimes people call us for last-minute rides, and we try to accommodate them, or we try to get volunteer drivers. But if they're calling us too late and we don't have the resources, then it's a tough situation. So we're doing our best with that. And let's see, Angela usually has me do the exercise program, so I'll jump into that. We have tap dancing on Mondays, no experience or partner required, but lots of fun, and that's held at FRS.
Right.
And you need your own shoes for that?
Yes, you do.
Okay.
But if you happen to be a woman in a size 8, we have an extra pair.
Okay, that's always good to know. It's like bowling shoes. On Tuesdays, we have 2 classes. We have a Zumba Gold class in the morning at St. Irene's, and then in the afternoon, we have a Tai Chi class taught by our own Linda Sango. And that's popular. One is at 10:45, and the Tai Chi is at 12:30.
12:30.
Yeah. On Wednesdays, we have a Hatha yoga class that is actually offered through the rec department. So you can register through the rec department at 978-369-9815. And I should say, registering for all of the other classes, you'd call the COA office at 978-371-2895. And there's a line dancing class in the afternoon, also at St. Irene's. The Hatha yoga class is at Benfield,
Right.
and the line dancing class is at St. Irene's. You'll notice that we're mentioning where they are because we don't want you to go to one place and the class is in another place. And occasionally, something will happen and we have to switch locations. So please read your newsletter carefully and pay attention to Angela's emails so that we get you where you need to go. On Thursdays, we have fitness and cardio boost classes that are both right here in Carlisle Town Hall, as a matter of fact, right in this room. And on Fridays, there are 2 classes. One is a senior approach to maintaining agility, or SAMA class, which is also right here in Town Hall in the Clark Room. And we have the newest offering, a chair volleyball class that's being held at 11 a.m. over at FRS. We also have an outdoor walking club that's still going on.
Yeah.
That's
Till they can't walk anymore
so they can't walk anymore. That's Thursday.
You mean because of the weather, right?
because of the weather. Absolutely.
Right. You can snowshoe and you can cross-country ski after that point. Meet at Center Park for a 2-hour walk at a moderate pace, weather permitting. For questions, contact Jane Anderson or Helen Young. The phone numbers for Helen and Jane are in the newsletter. And let's see, we have a podiatry clinic coming up in November.
Yeah.
November 4th and 5th. That is also held at Benfield Farms. The podiatry clinics are by appointment only, and the cost is $25, but they would normally be $35. Our friends of the Carlisle Council on Aging are subsidizing $10 of the cost. for our seniors. And we have blood pressure clinics at most of our local events. For example, our COA coffee, our Chelmsford Crossing lunch, our men's breakfast, and at Senior Moments over at Ferns.
Yep. So I should tell people about those things. So we do have monthly coffee at the Sleeper Room at Village Court, 145 Church Street, and that will be on November 6th and December 5th. And on November 6th, we're actually being hosted by the fire department. And in December by Nancy J. Seen and Vanessa Maroney, both of whom are with our friends. And the men's breakfast is on November 14th, which is the second Thursday of the month, and December 12th. And my husband does that, and we get a good turnout, and we hope that it's at 8 o'clock in the morning, so even younger seniors or people that don't think they're seniors yet, who may be in their 50s, who would like to join us before they go to work are welcome to come and get a hearty breakfast.
Hearty breakfast. You don't have to eat for a week after you're going to one of those. I know from experience.
And then we have Senior Moments, which is a coffee at Ferns, which is on the coming up November 25th, December 9th, and 23rd at 9:30 at Ferns. And you buy your own coffee at a discount for seniors, and we will provide the refreshments on the first of the programs during the month, and the last one, Bridges, will cover the cost of the refreshments. And then we have a number of other groups coming. We do have a knitting group that knits for themselves to make whatever they want, and they're on the first and third Friday of the month at the library. And we have another group that's through FRS called KISS, where we meet and knit for the homeless through the Common Cathedral. And so we met last week and actually started tagging for the gifts to go in for Christmas. And we're hoping that if anybody wants to do something by October 28th, they drop off, whether it's a hat or a scarf at Town Hall. And if you miss this deadline, you can bring it in another time. We'll save it for next Christmas. So we do have Reiki and meditation and our annual wreath making on December 2nd. So if you're a senior and you would like to come and make yourself a wreath with the help of the Garden Club, please call us and sign up. And we have social hour at Benfield on November 18th and December 9th. And David, you have some plays.
We do have some plays. As a matter of fact, we've got a Concord Carlisle Players dress rehearsal of Funny Girl, which is occurring November 7th at 8 p.m. And the seniors are eligible to go to the dress rehearsal. It's $10 at the door. No reservation is necessary. I don't know if the rumor that Barbara Streisand is going to show up for Funny Girl is true or not, but we'll see. Because if she's going to be there, I'm going to be there. I'm a Barbara acolyte. On Wednesday, December 4th, there's another senior dress rehearsal this one's for A Christmas Carol by Charles Dickens at the Theater 3 Company in Acton. That's at 7:30, and the tickets are $5 at the door. No reservation needed. There is a trip, though, that the Seaway is arranging for Miracle on 34th Street, which is on Wednesday, December 11th, at the Boston Stage Company, which is the old Stoneham Theater. And I keep forgetting that. And the tickets are $37 for the tickets. They have to be purchased in advance. So you're going to want to call Lillian De Benedictis. Sorry, Lillian, for butchering your name. Lillian's number is 978-369-1848. Please reserve by November 26th for the Miracle on 34th Street show, which again is on Wednesday, December 11th. And did we talk about Mancha Mancha? I can't remember.
No.
Oh, okay. We have a trip to the restaurant Mancha Mancha in Billerica, which I still haven't gotten to. I heard it's really good.
It is very good.
And that's on Tuesday, November 12th. So in case we didn't feed you enough at all these other places, we're feeding you there. And then there's a couple of great community conversations, right?
Yes, we're starting to now feed your mind. So in November, we have an antique clock presentation by the Delaney family of Delaney Antique Clocks, and that will be at the library. And we have Atul Gawande's Being Mortal, the book that if you haven't read or learned about is very important. And so that will be on December 3rd, also at the library. And we're starting a new program. We found that we have quite a few seniors in Carlisle who are Chinese and speak only Chinese. So one of our Meals on Wheels volunteers suggested maybe we could get them all together. And so we were lucky enough to have the Chinese school teacher be willing to host. So we're going to do a pilot program on November 13th at Benfield and try to see if we can get people together to have some conversation between themselves and maybe make some friends. And we have another one that isn't in the newsletter that I'm just working on now. We had a new person move into town. He speaks French, and he offered to do a French conversation group, which we used to do years ago. So we're working on that. So we'll have another conversation. And before time runs out, talking about medical information, besides for writing down your medical information, we can give you File of Life full sheets, little cards that go on your refrigerator for first responders, and you can come into the COA office or ask us to mail one. But we started a program this summer called Yellow Dot Program, and it looks like this, and it gives you a form that you can write all your emergency information, your medicines, your doctor's information, and it goes in your car. And this sticker goes on the driver's side rear window. So a first responder in an accident knows that your medical information is in there. So if you have an allergy or if you take a lot of medications, so that first responders know what those medications are and they don't give you or they don't take you to a hospital to give you something wrong that could hurt you. The other benefit is if you're a diabetic and maybe you're on the highway and you're swerving and they may think that you're drunk and it's actually you're having a medical incident, the fact that all your information is here and you tell the person, well, I'm diabetic, it just gives them the information to say, we're not going to try to see if they're under the influence, we're going to go right for that. So these are free. We have them, the police station has them, and the fire station has them. So please come in and get one if you have allergies or you take medication that could be affected for your care.
Thank you, Angela. And a special thanks to Alexandria Papadimoulis for being with us today. And just so one of the takeaways from this, from Angela and from Alexandria, is the hotline for the poison control hotline is 1-800-222-1222. And I encourage everybody to make a list of your medications so that you have them at hand. It's important as we're for day-to-day information, but it's also important if you're going to look at new Medicare information. And I believe you're hosting a Shine representative.
We are on October 31st.
October 31st here in this room.
Absolutely, and if you want a one-on-one meeting, you can call and we'll schedule that for you. And we want to remind people that open enrollment is already underway and ends by December 7th.
Right, right. Very good. Well, thank you all.
Thank
and
you.
we'll see you in a month.